Now, seventh day after anterior resection, the same patient develops fever, generalized abdominal pain, guarding, rebound tenderness. Now, what is the most likely cause? So, seventh post-operative day, and patient is having sign of peritonitis in this. So now what will be the reason? Would it be a DVT? It will be an infective exacerbation of COPD, pulmonary embolism, anastomotic leakage, or a pre-existing chest infection. So now the reason for this post-operative pyrexia at the seventh day would likely be anastomotic leakage. So peritonitis approximately 1 week after colorectal surgery is the hallmark of anastomotic leakage. So generalized peritonitis with guarding, rebound tenderness, and fever at seventh day is equal to anastomotic leakage until proven otherwise. So in this scenario, this is our principle on which we will build our concept that how can we manage it and what are its different features. Now, this is one of the most serious post-operative complication, no doubt about that. What are the risk factors? Now, if there is a low anastomosis, if there is a tension on the anastomosis, if that area has a poor blood supply, the patient is overall malnourished, or the patient is using steroids, or there was a contaminated field, all of these factors will increase the risk of anastomotic leakage. So, how can we manage once the patient has developed it? So, IV antibiotics followed by CT abdomen pelvis. Now, for this, we will use a water soluble contrast enema or a CT with contrast. Now, after that, we need to operate the patient on urgent line. Now, what will be the surgical management? That will be making a defunctioning stoma or performing the Hartmann's procedure. So in this scenario, not only we have learned that what is the pathology that is most likely to occur at the seventh post-operative day, but we have learned that how can we manage it. So there are two types of management. There is first initial management, in which we usually resuscitate the patient and follow it with some sort of medications, and then we make sure that the patient gets a CT scan, and then we move towards the surgical management, and that includes either performing the Hartmann's procedure or performing the defunctional stoma. So this is very high yield for the anastomotic leakage. So again, just to give you a overview to build your concepts further, peritonitis is likely to develop at 5th to 10th day, and that is because of the anastomotic leakage. Investigation will be CT scan. What it will show, it can show you free air, fluid, or contrast leakage. Risk factors is low anastomosis, tension, poor blood supply, steroids, or malnutrition. What is the management? Giving the patient IV antibiotics and urgent surgical review followed with defunctioning stoma or Hartmann's procedure. DVT or pulmonary embolism present with leg pain and associated respiratory symptoms, not peritonitis. So that is high yield. So do not confuse that, go with one concept that okay, on the seventh day, DVT or pulmonary embolism is likely to be the cause. Also try to correlate the clinical picture with the concept.